This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Reopin Injection is a vital medication used in emergency situations. It contains atropine, which aids in restoring normal heart rhythms. Indications and uses. This medication is primarily indicated for restoring normal heartbeat during emergencies such as cardiac arrest. It is also utilized as a pre-anesthetic to reduce salivary secretions and manage heart rate fluctuations during surgeries. Additionally, it acts as an antidote for poisonings from certain substances, including insecticides and mushrooms. Furthermore, it is effective in reversing muscle relaxants effects during surgical procedures and managing severe muscle disorders such as myasthenia gravis. How it works. Reopin Injection functions as an antimuscarinic agent by blocking acetylcholine's effects in the body, leading to increased heart rate and reduced body secretions. Directions for use. The administration of this injection is performed strictly by a healthcare professional. It can be given intravenously, intramuscularly, subcutaneously, or through the trachea via an endotracheal tube. The appropriate dosage and duration will depend on various factors, including the patient's age, body weight, and specific health condition. Possible side effects. Common side effects may include dry mouth, blurred vision, rapid heartbeat, and constipation. It is essential to seek medical advice if any side effects become severe or troublesome. Precautions and warnings. Caution is advised for individuals with kidney or liver diseases, as well as those with heart conditions or chronic pulmonary diseases. Pregnant and breastfeeding women should consult their healthcare provider before use. It is also crucial to inform the doctor of any pre-existing conditions and current medications to avoid potential interactions. FAQs. 1. Can Reopin injection be used for emergency conditions? Yes, it is effective during cardiac arrest and in managing poisoning. 2. What precautions should be taken? Inform your doctor about any pre-existing conditions and stay hydrated. 3. Can it be administered via the trachea? Yes, it can be given through an endotracheal tube by a qualified professional. Thank you for watching. If you have any questions or suggestions, please leave a comment below. Your feedback is appreciated.